Thank you for joining today. My name is Robert Bache, Medicare Bob. I own Senior Healthcare Direct. We are a nationwide Medicare insurance agency. We help people just like you with their Medicare Advantage plans, Medicare Supplement plans, as well as we are actually certified to help with Medicare Part D, the drug plans. However, in this video, I am going to discuss why the Medicare Supplement Plan G is a much better option than the Medicare Supplement Plan F. If you grab a pen and paper, I'll give you a minute to do that because this is really going to help illustrate why you should choose a Plan G over the Plan F. So in my mind right now, you're grabbing a pen and paper. All right, let's pretend you have that now, okay? So next to Medicare Supplement Plan F, or if you're just mentally making notes, write down full coverage. And then underneath that, write down Medicare Supplement Plan G, and next to Plan G, write down greater value. I'll explain. With a Medicare Supplement Plan F, the full coverage supplement plan, you will have no copays, no deductibles, and as you know, with any supplement, you can go to any doctor, any hospital that accepts Medicare. So you will never have to come out of pocket for any doctor visit or any service that's covered by Medicare if you have a Plan F, which is super cool, okay? However, a Plan F is normally $300 to $600 more expensive than the Plan G. So going back in our mental note or on our physical pen and pad, next to Medicare Supplement Plan G, the greater value plan, write down for benefits, the only difference is you pay the Medicare Part B annual deductible, which for 2016 is only $166 for the year. So the math is simple. The reason the Plan G is a greater value than Plan F is why would you pay an insurance company $300 to $600 more per year just so they can pay your $166 deductible? You won't. Don't. I will not let you. Cross off Plan F. It does not make any sense to have a Plan F just on the savings that the Plan G offers. Now I'm going to answer some questions that I receive about a lot of what if scenarios. People say, Bob, I understand the math makes sense now, but what if the Medicare supplement, what if the Part B deductible increases from $166? Well, it was $147 for like 3 or 4 years before 2016. So it's not like it usually changes that much. I actually do think it is going to change some. Okay, I predict it's going to continue to increase a little bit each year. Maybe not every year, but every few years. But even if it does that, let's say in 3 years from now, the Part B deductible is $250, which means that the Plan G now is going to require you to pay that $250. Now, this is a hypothetical in the future. Well, if that happens, the math is still going to be in your favor because if somebody has a Plan F, the carriers that are offering the Plan F is now going to have to pay that Part B deductible, the increase from $166 to $250 for all the millions of people that have the Plan F. So if they have to increase their benefit, they're going to increase what they have to pay out per person. What are they going to do to compensate for that? They're going to increase the premium pricing on the Plan F to compensate for that. They're not going to eat that loss. So people that have a Plan F, if that Part B deductible increases quite a bit, they should expect a higher rate increase than normal that year. So your Plan G is still going to be more stable and still going to offer you savings. Another question I get is, well, why is there such a difference in premium price between F and G if that is the only difference? There's a few different factors, but one of the biggest reasons is the Plan G can be more selective on who it takes into their plan. So let me explain. Everybody, when they first turn 65 or they join Medicare Part B as in boy, they're in their initial open enrollment period, which means they can get any Medicare supplement plan they want. Plan F, Plan G, Plan N, the whole alphabet soup. They can get whatever plan they want. But that is the only time that someone can get a Plan G, for example, without having to medically qualify. Is when they first turn 65 or get their Part B. That's the only time in someone's life right now they can get a Medicare Supplement Plan G and they don't have to qualify for it. That's not the case with a Plan F. The Medicare Supplement Plan F has certain guaranteed issue situations for people that they cannot be as selective on who the Plan F accepts into its plan. I'll give you an example. A lot of the retirees from Ford or AT&T, for example, they've lost their insurance the past few years. It's really sad that they lost their coverage that they were guaranteed for life. It's not for life. They got taken away from them, which is a shame. But all those people, Medicare requires that those people are automatically accepted into the Plan F supplement, which is great for them because they can get a great plan. However, not everybody there is in great health. And Plan F cannot say no to those people, whether it's Mutual of Omaha, Cigna, Aetna, United Healthcare, which is endorsed by AARP, or Blue Cross. If they lost their insurance, they're automatically approved for a Plan F, to where if they want a Plan G, they have to medically qualify for it. So another reason that the Plan G typically has more stable premium pricing is because it's more selective on who it takes. But you don't have to get overly detailed on this. The point is G is a better buy for you. May not be a better sell for the agent because agents make more money when they sell Plan F. That's why we typically sell Plan G more than any other plan, because it's the right plan for the client. But G makes sense. Do not pay an insurance company $300 to $600 more right now just so they pay that $166 deductible for you. Now, a lot of people think they have to wait until the annual enrollment period to switch from an F to a G. That's not the case. Okay, you can switch right now. You can go from a Plan F to a Plan G. Now, you do have to go through what's called medical underwriting, but it's not like life insurance where you have to get lab work or physical. It's just some health questions that our agents ask you on the application, and then we submit the application to the carriers, and then the carriers will tell us if you've been approved or not for the savings. So if you have a Plan F now, and you want to transition to a Plan G because it's a no-brainer and it's going to save you money, okay, then there's 3 ways you can contact us to help us do that. 1, you can leave a comment on the page, and I can contact you that way. You can also, on the page, on our Facebook, you're going to see our phone number, and you're going to see a link that is on our website where it's like, get a quote. So you can actually just fill out that form, and then one of our agents will follow up with you. What's cool about our agents is we're not only licensed nationwide, but we also represent every single top Medicare supplement company that offers the Plan F and the Plan G. So we'll take a look at whatever carrier you have on the Plan F, and we'll see how much money we can save you for a Plan G. Also, don't forget to share this. You're not the only person. You know, Plan F is still the most popular plan, even though, as I pointed out to you, G is a much better purchase. So share this to your friends. You know, you'll save them hundreds, if not thousands of dollars. Because remember, let's say you save $600 this year. Well, you're going to save maybe $550 next year, and then $500 the following year. This is potentially just a ton of savings for you. So give us a call, leave a comment, or go to our website and request a quote, and one of our agents will contact you.